this is Eileen with Bega, and as you can see, I'm out on a walk, and I've been thinking about something. I do a lot of PRN, and I've been hearing this thing lately just a lot. Like everywhere I go, therapists will tell me, "Oh, Margie didn't reach her goals because she's self-limiting." Self-limiting is something I hear all the time, and I think, well, it's probably too. Maybe Margie really is self-limiting, but does that really get us off the hook? Isn't the challenge for us to get through Margie's self-limiting behaviors and try to get her to improve her lot in life anyway? I think it's really easy for, and this is no slam on anybody, but I think it's really easy for all of us to say, oh, my patient is self-limiting and that's why she doesn't do her transfers, that's why she doesn't do this, and it takes all the heat off of us, all the pressure off of us, and none of it is our fault. And I'm not saying it is our fault, but the challenge is to overcome her behaviors. I mean, when you think about all the people we work with, they're not exactly on an even playing field as us. Most of them are older. They don't feel good. They're there for a reason. Many of them have dementia. Depression is everywhere. And the challenges that they have to overcome are so much bigger than we can even understand, because truth be told, a lot of their things are never going to go away, and a lot of things are never going to get better, and they know what the future holds. They're not coming out of college and all excited going to work. They're at a totally different phase of life, and it's very difficult. They've suffered a lot of loss, and I think that of course they're self-limiting, a lot of them. And I think a couple things that we can look at is, first of all, what are the goals that we're trying to get them to do? Are the goals really meaningful to them? Anybody who doesn't feel good, if you walk in and say, oh, it's starting to rain, hey, let's go to therapy, they're not going to want to do that. They don't want to go down to the gym and get on a bike and work out and do putty. That has no meaning for them at all. I mean, so I think we need to really kind of think what's important for them. It might not be the same thing that we think is important to them. I mean, do they want to be able to roll around the building? Do they want to go outside? Do they want to have some more freedom? Do they want to be able to eat something different? I think we really need to get to know them and find out what's important to them. If it's important to them, they'll be a lot more motivated to work for it. And the other thing is, I think we got to think outside the box. Maybe, as I said, the gym is not where we're going to help them do the things that they want to do. Let's go from another angle. What is their interest in life? Do they like motorcycles? Well, maybe we could go outside and we could work on motorcycles. Looking at motorcycles online is what I meant, and they could teach me something. A lot of times when you work with a person and you let them be in the boss seat and they're teaching us something about their body of knowledge, that gives them a sense of empowerment, and then they become a little less self-limiting. They might look at themselves in a new view. I think looking at it themselves in a new way is part of how we help them overcome these self-limiting behaviors. They're self-limiting because they think that they're worthless. They think that they have no reason to even live or go outside or learn to walk or learn to stand or putty. That's nothing to them. But maybe if we can help change that and help them see that they are useful and they are needed and they are special and precious, then maybe they won't be so self-limiting. So I'm not sure if I explained that feeling very well, but I am going to issue a challenge to all therapists to look at your patients in a new way. Are they self-limiting? If they are, don't say, oh, they're self-limiting, we can't do this and I can't do anything else with them. Think, all right, how am I going to use myself, my therapeutic use of self, the person that I am, and the relationship that I've built with them to make them think more of themselves, so they want to get goals, to look deeper into things that are important to them so that we are doing things that are meaningful to them. And maybe you won't get all the goals that you want, or maybe they won't do these things that you think they should, but maybe in a little bit you can help make their life better, even if you don't change anything big. Like my one friend said, she's an occupational therapist like me. She's a very special person. She said to me how lucky we are to be in the profession of occupational therapy, of helping others, because even if we can't change them in big ways, we can help them in small ways. And this is, in a way, she said, there's a grace to it. And I love how she said that there's a grace to what we do. We might not achieve all the goals, we might not change the whole world, but maybe we'll change their world just a little bit. And when we change their world a little bit, we change ourselves too for the better. Okay, that's all I gotta say. Back to my walk. Thank you.